So our next speaker is Ling Cao. She's a professor in the College of Osteopathic Medicine here at UNE. She's had two postdoctoral fellowships that are really interesting, one on the kind of neuroscience pain side and another one on the immune system. So she's really a neuroimmunologist kind of converging these disciplines and fields. And she also has some medical background training, and she has really taken a really holistic approach with the Mercy Pain Center up in Portland and really engaging our students in some interesting research that goes above and beyond her basic science laboratory. And I think she's going to be talking about some of those experiences. Ling?
Thank you, Ed. All right, so the title is Explore Outside of the Cages. And basically what Ed just said, I have been working in the laboratory, with the mouse models for years. And then I started explore a little bit outside that and doing something different. So hopefully by the end of the talk, it makes more sense to you, this title. All right, so just for those who doesn't know me, and I give you a little bit of background about myself. So I had my medical training in China that was called Beijing Medical University, and now it changed name. But anyway, during those years, what actually mostly interesting to me was learning about the mechanism of a disease and trying to understand the underlying mechanism. So I felt, really doing research is what I want to do. So after that, I actually went to pursue a Ph.D. degree at SUNY Albany, and most of my work was done at Westwood Center as the laboratory in the Department of Health in New York State. So that was my first introduction of neuroimmunology. Most of my study was how the immune system react when an animal or human under stress conditions. And I continued that work for my during my first postdoc at a neuroimmunology center at the University of Rochester. And then later on, I joined Joyce DeLille's lab. She's very big on neuroimmunology and pain, so that was my first introduction in chronic pain field. So I'm a relatively new in this field. But I was lucky enough to get recruited at a Unicom 8 years ago. And just like, but during that time, I'm still kind of continuing with my basic science research. And um, just like any other faculty, I do have to do teaching. So I had a more interaction with students, with clinical faculty. And that's kind of reminded me some things I haven't used for years, what I learned in the medical school. Um, but most time, if people ask me, what do you do? This is what I tell people. So I'm looking at a neuroimmune mechanism and how that affecting the development of neuropathic pain. We use the mouse models, and I found this picture on Google. It's really nice. So scientists actually made a monument attribute the contribution of a mouse to our work. So anyway, in the last year, I actually had an opportunity to take my sabbatical year, and then that's actually changed my view of chronic pain significantly. So I had opportunity to shadow primarily Dr. Hall at a Mercy Pain Center. That's kind of reminded me a lot of things I learned in medical school, and really kind of changed my view about a chronic pain. And I think a lot of you probably know this, especially I think if you're a pain patient. Pain is not just a simple thing. It's not a one disorder, one disease. And it requires a lot of effort to manage. And this is just some examples that the treatment we are using currently, and any one patient probably have a multiple treatment over the years. And then on top of that, there's other things, social economical issues, whether a patient have the good insurance, the bad insurance, or they have to use a public insurance versus the private insurance. That's actually affecting what kind of treatment they get. And, the providers they're working with, how well they're educated in pain management, that will affect the care they are getting. And also how well they communicate the communication between patients and the providers. Those really important questions actually can all affect the management of chronic pain. And then looking back, what I have been doing. So it's very, very limited, I would say. We're trying to, discover this next generation of the new drugs, and that will cure everything about chronic pain. Um, and then we're actually just working on this little teeny bit thing. So it's a well before the drug can actually be introduced to the clinic. So I kind of felt like, so we have spent so many years in training, and then we learn a lot of skills. And we are good at what we do, but we can do better. We can do other things. The skills we learn in the laboratory does not have to be limited in the laboratory. We learn how to design experiment. We learn how to analyze data. Those are the skills we can use for other fields. So in the next several slides, I'm going to give you some examples that I start exploring what kind of project we can do primarily with the students. And we have many enthusiastic medical students. They are really trying to work something while they're studying in school that more relevant to their clinical practice. So this first one is a small paper survey study. So all of you probably know when you go to a clinic, you will be asked to rate your pain. So it's a very simple scale from 0 to 10. But how patients actually interpret that scale, how providers interpret that scale, it's very different. There are so many symptoms come with the pain. It's not just pain itself. So what we did in this little study is we selected top 20 symptoms that the most associated with the chronic pain. And then we just basically conduct a survey with both providers and the patient. And then we got some responses back, and then there are some interesting symptoms that, the providers think is not rated when the patient are rating their pain, and the patients actually think it's important for me to rate my pain. Um, so, but the drawback is with the paper survey, we had a drop boxes at the Mercy Pain Center, but not everybody going to conduct the survey, and we don't have a huge subject, a sample number. So to telling the student this year, they are continue with this project. So by the way, most of the projects I'm talking about is actually in the poster format out there. If you have any questions, want to know more detail, and feel free to stop by during the poster time. These two students, they actually thank for Eric's knowledge. He's really good at technology, and he informed us about this new research kit Apple putting out. So some university already started taking advantage of this. This basically is a platform you can use to design studies, and you can get really huge numbers of respondents for your study. So this is for our study, we're still in this designing phase. So we're trying to really learn about the research kit. And then the other thing, they designed it as a companion application, as a care kit. So patient actually could use that as a tracking device for themselves. And so we are going to add in a pain tracker for them. So if anyone download this app, and then they will have ability to track their pain, you can either simply put your scale or some other descriptive thing in there. And then when you go to your next appointment, you can show your provider, this is what happened in the last 3 months. I think they would have a much better understanding of your pain. So hopefully, by the end of the study, we'll collect enough samples, and then we'll be able to actually inform what we should do to actually improve the communication between the patient and the providers. And then this is another example of the study we did. So this is actually a secondary database analysis. So we use the main all payers claim data. So this is insurance claim data. It's not perfect, but it's something we can work with. And we got this data, and we basically identified the criteria we can use to identify chronic pain patient. And this is one of the results we had, basically looking at the percentage of a chronic pain patient within each county in Maine. And it's kind of surprising that when we did our literature search, there's really no good study on the demographics of a chronic pain patient in Maine. So this would be the first one. And we all know there are more chronic pain patients in terms, female patients than male patient, but we didn't expect this much of a difference. This is exactly the same scale, and this is a female, this is male, and it's very striking. And actually, when I showed this to a couple of physicians, some response I got, oh yeah, females are complainers, but I think there are more things we can improve. Once we have more data, and there are things, maybe we need to educate our physicians better too regarding pain management. And then this is a study ongoing. So this year I had two medical students. They're really interested in working with more doing more mechanistic studies. So what they set out to do is to actually they will recruit patients and normal individual, and then they will conduct all these sensory tests, the tests that commonly used in the research laboratory, and also they will conduct these surveys to evaluate the emotional state of the individuals, and then at the end they will try to correlate and to see if there's differences between the two populations, because things changed when you have chronic pain for years, and the correlations within normal individual might not be exactly the same in the pain patient. And on the side, what they are doing is actually testing out does the blood pressure cuff measurement to see if that would correlate with these common laboratory approved sensitivity tests, if this could be a very simple test that any providers can do. This is actually thank Frank's idea. Um, so if this would work, it will be very interesting. You don't have to buy really sophisticated equipment, and then there's a way you can actually test out your patient's sensitivity quickly, and maybe not the best accurate way, but it's something give you indication. And then, so at a Mercy Pain Center, they're not just, a patient come in and then they apply different treatment. And Steve actually also have this program for chronic pain patient. It's called the Living Life Well Pain Rehabilitation Program. It's a behavioral cognitive treatment group therapy program. So during my sabbatical year, I have been following groups and also from the beginning at the end. I was with the patient and doing the exercise when they need to do an exercise, and then when they have a group meetings, I participate in the group meetings. He collected a lot of data over the last 3-4 years, and anecdotally, it seems to be very beneficial for a lot of a pain patient, but the real critical statistical analysis have not been done. And one of our medical students, he has a really rich background on statistical analysis, and he took on this project this year. So hopefully we'll see some really promising result very soon. So besides Mercy Pain Center, I also had a connection with the Maine Children's Cancer Program. So one of our medical students, she's really interested in pediatric oncology, and and the pain management. So when she came to me and we kind of brainstormed, and okay, we can do something, maybe looking at a pediatric chemotherapy-induced neuropathy, because it's probably not surprising. A lot of information pediatricians use now is actually information obtained from adult patients. So a lot of things just being scaled down and applied to children. And here's just a couple examples of her result. And it's quite interesting that there might be sex difference during earlier age. It could be related to the developmental stage of the boys and the girls, and also not surprising that the drug classes, or whatever drugs you're using, actually affecting the development of neuropathy. And we looked at both the sensory and the motor function. And then besides working on student project, and I realized there, you know, just how much I learned at the pain center. I think other students, all the students should have the opportunity to do that too. So I started piloting a interprofessional pain clinic education program for students. And I was very grateful that many health professions at UNE actually contributed. They helped significantly. So we basically recruited. So we piloted the past spring, and we had two teams of students, and actually along with their faculty. So you know, every profession has a faculty. Being a supervisor, a mentor. So what the team did was actually they follow up a new patient at the pain center. So it's someone Dr. Hall has not met yet either. So the students had meetings before and after each appointment. They follow up the patient. They did the interviews, the initial interviews and the physical examinations, of course under supervision, and also participate the follow-up appointment. So, and they're very good, actually. You know, surprisingly, they're a lot of them are first-year students, but they're really putting their effort in there, and then they try to look up for resources, and then they develop a treatment plan, and then they were able to see what happens 6 weeks later after the treatment plan they initiated. Um, so and here it's just a summary result from the study. So for me, it is a study and educational program. And overall, there's increase in their knowledge in pain physiology and their pain management. So we only have another 12, so it's not quite big size inside at this point. And then their interprofessional collaboration skills is definitely improved too. So with this result, we're actually continue with the project, and then we're hoping to continue for many years. And in the future, we want to work with the multiple clinics, not just the Mercy Pain Center. And there are many local regional pain clinics. And the bigger dream is it could be expanded to not just for pain patients. There are many chronic diseases, you know, high blood pressure and hypertension and diabetes, and there are clinics for those. And then we could do something similar like this. And every student, they should be able to choose a clinic that they want to work in during their preclinical training. Uh, so just kind of sum up, we all know pain is really complex condition. Um, it's not, so just being in the lab working on a new drug probably not going to answer all the questions about a chronic pain. There are so many things we need to do. And as the take-home message, you know, we learn a lot of skill in the lab, and I think a lot of those skills we can use it outside the lab. And I think the main message is we can do more. So, thank you.
We've got time for some questions if you like.
Well done. To lead off on what do you perceive are the... Hi, again, for posterity's sake, well done. Sean Mackey from Stanford. Leading off on your closing statement, we can do more. What do you perceive are the barriers to doing more? What do you perceive are the barriers to capturing this information in your operations and then making good use of it?
Yes, so there's a lot of errors actually. So all these projects I was telling you, it's a really in the infancy, it's a small project, those students. So most of the students are volunteer. So, you know, if at some point they have to do more work than what they have done, and then there's no time for them to study to do other things. And I think a delegated fellowship and those kind of things would be very important. And you know, with the data collection with the recruitment, if we gotta have more resources, you know, we would definitely need more. With the educational program, it's actually, a lot of things I think it doesn't require more money, but it requires more passion between every individual. So we have a lot of, the program was able to be conducted. It was actually because all the faculty involved, they're really passionate about IB in education, and they're interested about teaching our students and getting them much better, in the future. And then there's the technical things. With the students, they're still in their pre-clinical years and then doing things in clinic. The HIPAA regulation, a lot of the things they're not employed in the hospital, there's other things. But I think that collectively, if this is the goal for everyone, if, sometimes I kind of think back, we do a lot of things in the laboratory. And assuming that's happened to everyone. When you write an NIH grant, your first paragraph is your significance and why you do it. And if you all look to the big picture, the disease, the disorders, but sometimes I feel like you probably too focused and forgot this big picture. I think that's something we should all sit back and think about it. Our goal is to help with the chronic pain patient and then to figure out better ways to improve their life. Even there's no money, there's something we can do.
I have two questions. Right, you're hard to orient. The first one is, in the young children with the motor and sensory neuropathy, what was the measure of sensory neuropathy that you were looking at that showed that marked difference? And the other one is, when you showed sort of this distribution of, throughout the state of Maine, of incidence of pain in men and women, do you have the resources within that database to drill further down to look at particular individual conditions?
So the first question with the children, it is actually that good. Well, one thing we could draw from the result is improvement of the record keeping. So for that study, it's a chart review study, and it was actually before the clinic transferred to the electronic record. So it was all hard copy record. So students spend many hours looking through pages. Not every provider documents everything, relates to neuropsy. So she has to really look between the line and then looking for, either the patient complain about certain things or, just a simple phrase the provider's putting in. So what she did was, looking for those specific terms and applied it to the two common used scales for neuropsy. And then the one I showed is one of them. And, do her best work to trying to really give a score for that. And then she also looked at it in the 3 months interval. So for every patient, she looked at it from their beginning of the chemotherapy treatment and then lasted for a year after the ending. So it was quite a bit of work. And what we came out after that, actually the clinician we collaborated, he said we should, put a new policy that everybody should document these correctly. And I think, all these little things that would contribute to patient care a lot. Things we might not even think about it. For the second question,
The question was, in that distribution of chronic pain conditions, whether or not you have within that database the ability to drill down to look at individual conditions.
So yes or no. So it's an insurance payer data. So there's a diagnostic code in there, but we don't have individual record. So the way we identify a chronic patient is basically based on the code. It's not most accurate way, but that's kind of the best way we can use to do that. And also that's probably another policy issue. So there are so many databases out there available for study, but many of these databases are sort of a standalone. If there is a connection between databases, they would actually help tremendously. Some databases have more information about an individual and some don't. But if there's some linkage between them, that will all help. Thank you.
Great job, Megan. Really inspirational message. We can all do more. I think she was also asking for some resources, so I will find some resources to help. We'll continue to do work, and we're going to lean on our state and federal representatives here to try to increase funding for these exciting things that all of us can contribute to. So thank you.